You would never know this college softball star pitcher just a few months ago was facing surgery for a badly torn ligament in her elbow. Her injury was so severe she had to sit out many of her team's games.
Oh, I had terrible pain in my elbow. I couldn't pitch. I was going to be done for the season. I wasn't hitting my spots. I wasn't throwing as good as I could. Nothing was going right. It was bad. I was pitching terrible.
Doctors told Allison she needed surgery to repair her torn ligament and would be out of action for almost a year.
Oh, I was tore up. I love playing ball, and just thinking I wasn't gonna be able to play with my team the last year, I was very upset.
But at Spartanburg Regional, orthopedic specialists are offering an innovative new procedure that helps patients avoid surgery. The non-surgical procedure is called platelet-rich plasma therapy.
Platelet-rich plasma therapy is a relatively minimally invasive type of procedure that involves taking a patient's blood, much like they'd have blood drawn for normal laboratory work, and then placing that blood into a centrifuge type of device, of which there's a number of different types, and then spinning that blood and separating the contents of the blood. Then we take these out, and you take out the test tube and put a needle into the layer of platelets, if you will, and you suck out the layer of the platelets into the syringe that you're going to inject the patient with. It's an injection that will kickstart the body's own healing process, so to speak. And normally we think of platelets as being involved in clotting or blood clotting, which they are. But in addition to that, they contain a number of different types of granules that have a high protein content that are associated with tissue healing.
The entire process takes about 20 minutes. Patients will have some physical therapy after the injections.
Potentially, it can play a role in healing musculoskeletal injuries and or even cartilage lesions of any joint in any part of the body. So for example, you could consider injecting the shoulder in patients that have rotator cuff problems, the elbow for tendon type problems, the knee similarly.
Allison started pitching again within a month after treatment.
I would be sore for a couple of days, but that's all. It would go away within 2 days. It's great. I'm back to normal how I was last year. I had a very good season this year. This year I had 133 strikeouts. I was picked for first team. I was very successful this year. It's probably my best year I've probably ever pitched, really.
Innovative treatments, advanced technology, helping patients get back to their lives faster at Spartanburg Regional.